Hello, and welcome to Bitesized Podcast. I'm your host, Andali. Bitesized is a nutrition-focused podcast helping you through pregnancy, postpartum, and the solids journey with your little one. If you're joining us for the first time today, welcome. We saved you a seat at the table, so don't forget to subscribe. Today, we are starting a discussion on pelvic pain and pelvic floor dysfunction. This has certainly been a hot topic on the internet for a while here, and you've probably heard moms talk about prolapse and ab separation a lot. If this is your first pregnancy, I hope that all of this honesty on the internet has not left you scared out of your mind. This is kind of where I come in. I think there is so much sharing of the personal experience online that sometimes we forget that there are professionals out there who are also trying to provide some education to help make those personal experiences a bit better. While I generally focus on the nutrition aspect and how it affects so many parts of pregnancy, birth, and postpartum, I also love to have guests on to help you broaden your education and help you find the support you need. So that's a little hint for today's episode. Now let's dig in. Growing a human is no joke. It is super common for you to gain weight as well as carry the weight of the little human all over just a short 9 months. So it's very understandable that it can put a strain on your joints. Joint pain is very common. This can also be in part to the hormone produced during pregnancy called relaxin, which loosens ligaments and joints in preparation for the baby to pass through the pelvis. So what are some ways we can help the pregnant body through this uncomfortable symptom? Number 1, exercise. As tired as you may be, exercise is only going to serve you. We've all been there, whining, not wanting to get our butts outside for a walk or to that fitness class, but I have always been happy I did, and you will too. Staying active throughout your pregnancy will help you maintain your muscle tone, which in turn supports the joints as ligaments loosen. A walk is always good, but if your joint pain is restrictive, try swimming. Swimming takes the weight and pressure off of the joints. When I was recovering from my car accident, the swimming pool was one of the only places I could walk properly and put weight on both of my legs. The water just really helps, and I would definitely recommend it. Number 2, reduce inflammatory foods. Sugar, processed foods, industrial seed oils, and trans fats all contribute to inflammation in the body. I've talked before about choosing our ideal options and balancing our meals, so if you missed that, go check out episodes 2, 3, and 5. They're just bite-sized, so you'll be caught up in no time. As a reminder, I do have a free guide on my website all about balancing meals. It's free to you. All you have to do is download it at bitesizedpodcast.com, and it'll come right to your inbox. Number 3, increase anti-inflammatory foods. Omega-3 is very important for reducing stiffness, swelling, and pain in joints. Of course, we all know omega-3 is the magic in fishy foods, so if you aren't a fish eater, be sure to supplement. Needed supplements have a wonderful vegan omega-3 that you can add to your routine. The cool thing about Needed's omega-3 supplement is that it has a bergamot flavor, and I don't know about you, but it is one of my favorite fancy flavors, so I love that. Omega-3 also has wonderful benefits beyond lubing up those joints, such as cognitive, skin, and mood improvements, so not a bad addition to your supplement routine at all. As always, you can use my code BITESIZED for 20% off your order. You can also get some good omega-3 in flaxseed oil, walnuts, and chia seeds. In addition to some more fishy foods or omega-3, bone broth or collagen will also be a wonderful addition to your life. Bone broth has both collagen and gelatin, which are really good for supporting joints and connective tissue, so it can help avoid injury. Gelatin is rich in calcium, magnesium, phosphorus, and so many other things that are good for bone healing and take the pressure off of joints. When looking for a collagen supplement, look for grass-fed collagen. Collagen powder is a very easy addition to your diet as it does not have a very distinct flavor, so you can add it to smoothies, water, oatmeal, and so on without it affecting your taste. Bone broth is super easy to make if you cook with meat, but I will say it is time intensive and not everyone loves to store bones until they're ready to boil them down. So don't feel like you have to do that. You can definitely hit a health food store and buy some bone broth. Needed also has a wonderful collagen supplement, so again, you can use my code BITESIZED for 20% off. Bone broth also contains glucosamine and chondroitin, which are common supplements for those struggling with osteoarthritis. So again, have some bone broth, or you can look for these as a supplement, which are well known for joint care. Now that is sort of where my expertise as a certified nutrition consultant ends, but there's still more to come. Lastly, you can work with a pelvic floor physiotherapist, which brings us to our guest. I'm so excited to introduce Rachelle of FRANK. Welcome, Rachelle, to Bitesized Podcast. Thank you for joining us today. How are you?
Good. Thanks for having me.
Yeah, I'm so excited to get going on our conversation. Before we do, please tell us a little bit about yourself.
I'm a pelvic floor physio, and I just recently moved here to Calgary from Vancouver. So it's been really fun to integrate myself into a new city. And I'm a pelvic floor physio who also has a background in strength training. So I've started this business called FRANK, where I have like pre and postnatal education and workouts for people that are having babies and birthing babies.
I love that. Tell us a little bit about what got you into pelvic floor physiotherapy.
I think like anyone going into any profession, it is a personal journey. Me in university, I like couldn't hold my pee for the life of me. And I didn't think it was a problem until I realized that there was something called pelvic floor physio. It was like a kind of divine intervention where I was trying to find a thesis topic, and my supervisor was like, well, we've got this physio who's also a comedian who uses her comedy as a way to study. Can we educate people about their pelvic floors through comedy? And she had this skit about like the inconvenience of incontinence. And so I worked with her and was like, oh my God, pelvic floor physio, that sounds like something I need. And I got into the field that way.
Wow, that is very interesting. I'm very excited to dive into the topic of urine incontinence for sure. But for the listeners at home who may not know what the pelvic floor is, can you tell us a little bit about what the pelvic floor actually is and what it does in our bodies?
So the pelvic floor is a set of muscles that lives inside of your pelvis. It's not one that you see from your everyday, from the outside, like your glutes or your quads, but it has a super huge job in keeping things in the body when we want them to stay in, or letting things out of the body. So anytime we like cough or laugh or sneeze, pressure increases inside of our body. And our pelvic floor's job is to squeeze our sphincters closed. So we're not like peeing or farting or pooing just because we laughed or coughed or sneezed. Some of us are, and ideally, that's not what we want, but that is the pelvic floor's job. For those who have like an anatomical understanding, and you can imagine it goes from your pubic bone all the way back to your tailbone and kind of wraps over to the sides into your sit bone. So it's this like big net and like kind of a hammock that absorbs shock in our bodies.
That is a really good visual. I think that's helpful for people at home, especially when people are telling them, squeeze your pelvic floor, and you're like, what does that mean?
Yeah.
Knowing kind of even the shape of it, I think might help you like feel that sense in your body.
Yeah, totally. The amount of like butt clenching I see when I'm like, show me a pelvic floor contraction. And they're like, that's not it.
So as a pelvic floor physiotherapist, can you tell us a little bit about how you help people and what you do to help them improve it?
Well, the kind of populations that I see would mostly be people who are leaking when they don't want to be. I mean, I don't think anyone leaks when they don't want to be, but you're leaking without control. So that being if you leak any urine and less common feces when you cough, laugh, or sneeze. And then also just like peeing and like losing control of your bladder when you're running to the bathroom. So that's incontinence is kind of like a very big one that I see for pelvic floor physio. Also, people who want to have sex but can't. And that can be for many reasons, but often like more pain-related reasons. So we treat a lot of that. And then there's obviously like a huge population of people who are pregnant and are wanting to get ready to have a baby and wanting some support, or people who just had a baby and were told to go see a pelvic floor physio to help like rehab their bodies after that. Men, women, and anyone really come to pelvic floor physio, which is really nice.
That's very cool. You mentioned some things that people might be experiencing that would indicate they might want to see a pelvic floor physiotherapist. Are there any other symptoms that they might want to notice or look for that would indicate like, oh, I should see a specialist about this?
It would be great to do pelvic floor physio if, you're losing control over your bladder or rectum. If you want to be having sex and you can't. If you're having any issues with tampons, especially in teenagers, I think that's really important. And then also really painful periods. So endometriosis, I think, is becoming like a really known topic, and people have been experiencing super painful periods alone for a long time. So pelvic floor physio can be a really helpful tool for managing that condition. If you can't go to the bathroom comfortably, so that being if you can't empty your bladder fully, if you're feeling really constipated, but you've done all the digestive stuff and like still have a hard time getting it out. Like painful bowel movements or hemorrhoids. Also like deep core stuff. So pelvic floor physios, we know all the muscles on the inside, but we're also and know all the muscles on the outside. And so we treat a lot of like low back pain, SI joint pain, hip pain. Especially, it's like kind of nice that you get the trickle down of like someone will go see a regular physio and they're like, I can't figure it out with all the tools I know. And then maybe you should go see someone that's more in depth in the pelvis, and that is us.
This might be a little personal to question. I had to be on a catheter for 5 days a couple of years ago, and I feel like that kind of impacted my bladder control. Is that something that you see, or is that, because I feel like that's so minor and people experience it all the time if they go to the hospital, but I swear it has changed since then.
The pelvic floor is such a sensitive part of our body. And I always call it like the emotional vortex. Like it knows what's going on in your life before you do sometimes. And it doesn't like to be messed with. And catheters are pretty invasive and uncomfortable. And so sometimes there's a population of people that get UTIs really frequently, and they can have pelvic floor muscle issues like painful intercourse, for example, or pain with peeing and bladder filling, more so related to like muscle tension, which might be causing some of that like discomfort or like change that you might be feeling. Because your pelvic floor is like, oh my God, what was that? That kind of hurt. And maybe if I just like stay tight, it'll hurt less and it won't happen again.
Interesting. So if someone is like, okay, I'm experiencing one or more of those things, they come see you, how do you actually check the health of the pelvic floor, and what are you looking for? And is there a difference between like a tight pelvic floor and a loose pelvic floor?
Definitely. Not everyone should be doing Kegels. And I will repeat, not everyone needs Kegels. So when you go see a pelvic floor physio, there's a lot of like personal rapport involved. So we do both like subjective and objective assessments. Subjective to get like a better picture of who you are, what kind of life happened to you, what injuries have happened to you, what could be playing into the symptoms that you're experiencing. As physios, it's important that we check on like the function, mobility, and strength of the muscles outside the pelvis. So we'll usually assess your hips, we'll assess your core, we'll assess how you're breathing. And then pelvic floor, like specific assessments are an internal assessment. So it's usually very consent-based. So it's only if you want to. We can kind of assess the pelvic floor function externally as well, just a little less accurately. And it's usually like a 1 or 2 finger assessment, and you're draped with a blanket. We have gloves and we use lube, and we're looking at, okay, so we know these muscles are inside the body. We'll show you where they are. And we're looking for like, what's the tone like in them? Do they feel really tight? Do they feel nice and relaxed? And when you try to engage them, how well can you engage them? What parts of them are you engaging? Do you have endurance in these muscles? Does it hurt? And like, can you relax them all the way? So kind of to that idea of there is a population of people that need more strength. And I think it's great that we're talking about pelvic health way more than we used to be. But I also think there's a lot of misunderstanding. It's almost like, if I'm peeing my pants, it's because my pelvic floor is weak. And that's absolutely not always the case. I think that might be the case, especially for people who are going through menopause or postmenopausal, have recently had children or are pregnant, because your pelvic floor is being really affected by that. And birth, vaginally specifically, can cause pelvic floor muscle injury. So that can cause weakness. But like, I would say at least 50% of the people that I treat actually have more of like a tension related issue. And we hold our pelvic floor tights for many reasons. Like sometimes it's, chronic pain or a life where we've had a lot of anxiety. Physical and emotional trauma causes more tension in the body. And also just like misconceptions of like reading way too much Cosmopolitan and thinking that you're supposed to like have a tight vagina or like suck in your stomach. And all those things can cause overactivity in those muscles, which then also causes dysfunction.
That is very interesting. Yeah, I can definitely vouch for reading all of those magazines as a teenager, and you're sitting on the bus just squeezing the whole time. You're like, that's so funny. And over here at Bitesized, since we're very much for the pregnant and about to give birth people and into the postpartum stage, can you tell us a little bit about how a pelvic floor physiotherapist might play a role in that, and when would you maybe advise someone who wants to get pregnant, is pregnant, about to give birth, or postpartum come and see you?
If you're someone who's not experiencing any pelvic floor issues, like the ones we listed before, you don't need to necessarily come see a pelvic floor physio before becoming pregnant, unless you just want to go and learn, which can be really great. Once you're pregnant, We usually see people like after that first 12-week period, especially if you're wanting to do some internal assessment work. But I usually find if people are feeling pretty good during their pregnancy, I'll usually see them around like the 20 to 24-week mark, because that's when their body really feels like it's starting to change. And that's when they're starting to feel like a little bit more demand on their pelvic floor. So that's what I would suggest starting pelvic floor physio, but there's never like too soon or too late.
I love that. Never too soon or too late to start taking care of your body.
Postnatal, we respect the like at least 6-week period before you come and start working on your body. There's lots that you can do at home gently with your body. And there's like a whole section on Frank as to like suggestions on things, but really just like not pressuring the body to do more than the massive amounts of recovery that it's already doing in those early 6-week periods. And we're like, our kind of governing body suggests that like we don't do any internal work until 6 weeks postnatal. So that's usually when we see people postnatal. Sometimes if someone needs any kind of like gentle massage work, then we'll see them before. But there's so much change and recovery still happening at 6 weeks post that we still like shouldn't be making any conclusions about like how your body's doing at that point permanently.
Totally. That makes a lot of sense. And I know for regular primary care practitioners, 6 weeks is kind of when they'll get that checkup as well. So pretty aligned there. What kind of sort of diagnoses would you see with people who have just given birth that they might want to come and see a pelvic floor physiotherapist? So I'm thinking like prolapse, ab separation, anything like that.
All of the above. And like, I think everybody should go see a pelvic floor physio after giving birth. I think regardless of having a C-section or a vaginal delivery, your body has been really challenged by giving birth. And so there's rehab to be done. And you could be seeing a physio for that, and specifically pelvic floor physio. But like the most common conditions that I would suggest people like work with a pelvic floor to rehab are prolapse, incontinence. Perineal tear is something that we also work with. So there can be a lot of sensitivity, sometimes some numbness, and also just like fear of having sex. And so we kind of help people bridge that gap. And like any kind of like low back pain, neck pain, and core rehab, obviously with diastasis or abdominal separation stuff.
Okay, yes. So many things I want to jump into there. With the perineal tear, do you think there's anything that people who are pregnant can sort of do to prepare to sort of help that or prevent it, or is it sort of inevitable?
Yeah, I was just filming this education video like an hour ago for the platform. There's been a lot of research done on like what we can do to help the risk of perineal tears. So first, I just want to say that like perineal tears happen. And it's absolutely okay that they happen, but we need to remember that they happen on a spectrum of severity. So the most common types of perineal tears are like a grade 1 or a grade 2, where it's just like a little bit of the outer skin and maybe a bit of that mucosal tissue. And then there's more severe that can run from like vaginal to rectal opening, but they're way less common. So that's something that I think that people don't necessarily know at first, but I also totally get why this is one of the most common questions with my prenatal populations. Like no one wants their vagina tearing naturally. And so they've done some research, and what they've kind of concluded on things that can help the perineum from tearing or at least reduce the severity is being physically active while you're pregnant can help with some of the complications and some of the trauma to the pelvic floor with birth. The most effective one was using a warm compress. So that's like using a warm towel or like a wet towel against the perineum as the baby is crowning for 2 reasons. One, heat helps with keeping tissue elastic, and also having a little bit of pressure helps the parent kind of like, it gives a counter pressure of like where to direct your pushing. And the third is it slows down how fast the head comes out, which sometimes might surprise people because they're like, they just want to get this baby out of their body. But our body needs time to slowly open. And we know that any tissue that is stretched quickly is more likely to be injured. So it's better to kind of like slow that head pushing through phase, so long as everyone involved is safe. And a lot of practitioners do use the warm compress piece. You just have to talk about it beforehand to see if that's part of their practice.
Yeah, that's super interesting. It kind of reminds me of like when you're a kid and you're obsessed with rubber bands and you just like want to stretch them as far as they can go and they immediately snap. But if you sort of like slowly stretch it and like warm it up and kind of like take your time with it, it tends to be able to stretch a lot further without snapping. So
Yeah.
that makes a lot of sense to me.
Perfect analogy. Yeah. And the other one that they assessed was, have you heard of perineal massage before?
Yes.
It's a practice that, again, I think people understandably don't really get it. They don't get like what it's for. And people think you're just like massaging the tissue. And in some ways you are like massaging it to get blood flow into it. But one of the techniques is you're applying like a kind of a stretch to the perineum and going to the edge of discomfort. And that is the practice, is like, okay, once you're at the edge of discomfort, what can you do to soften and relax the muscles so that the muscles can stretch more? And so perineal massage is actually kind of more of like an exposure therapy and the learning of like, what tools do you have in your like physical and emotional toolbox to reduce the tension and the sensations of pain and essentially like the fears when you experience discomfort in that part of your body. And so the suggestion around perineal massage is like, if it feels good for you, then start it at 34 weeks. And you can do it like a couple to a few times a week. And ideally, you're doing it with somebody because it can be pretty hard to reach your vaginal opening when you're that pregnant at that point.
Yes, that makes a lot of sense. I know lots of women are sometimes nervous about, oh, I gotta go and get a wax before I go into labor, or like convince their partner to help them shave. So this is just another one of those things to add to the list of choosing someone who knows you really well and is not afraid to get intimate and help you out with that.
I think there's also a lot to say towards the psychological impacts on our birth and how our bodies, like, it's kind of tacky to say, but like our bodies are absolutely meant to be able to do this. Our emotional systems tend to get in the way. And it's a lot of new, especially for your first baby. And unfortunately, a lot of the pelvic floor issues that happen with the first, because there's so much resistance and unknown and fear around like, oh my God, what was that sensation? Which creates a lot of guarding and a lot of restriction in your body's ability to just do its thing. So I'd once heard this midwife just kind of give this analogy that when she was birthing, she was just picturing like the biggest, roundest, most elastic, enormous circular objects that she could think of. She was like picturing the moon and like, you know, huge vessels that were circular, and like picturing that being her vagina, just being like so capable of expansion. And I love it. Yeah,
I love it.
I thought it was so good to be like, no, we can do this. We just kind of need to like let it stretch.
Man, I love it. This is some good stuff. Moving a little bit into ab separation, what kind of does that look like, feel like, and how do you assist?
Okay, well, ab separation, something also called diastasis, is common. It happens to most people who are pregnant. And it recovers for most people within the first 3 months postpartum. So this idea that like we're trying to prevent ab separation is kind of false, because physically your core muscles will continue to be stretched throughout your pregnancy. And those two rectus abdominis muscles, which are like your six-pack muscles, will be stretched and move away from each other. So that's just what happens. And they were never sitting right next to each other in the first place. There was always a little bit of space and a little bit of connective tissue in the middle. So what our job is, prenatal, is to teach people about how their core works and how to manage pressure better. Because what we know is like, if you are doing exercises that are way too difficult for you and are creating too much pressure in your trunk and causing some doming through that midline, which is already pretty like compromised, then that can create more severe diastasis, or it can just compromise the tissue even more and like stretch the tissue out a little bit, which we don't want. We just want to like ease off this tissue that's already trying its best to contain pressure. And also just do like so much deep core work while you're prenatal so that the muscles feel as strong as possible going in, so that you can kind of help recover them a bit faster after. And then postnatal, we usually just like assess, okay, to what extent do you have diastasis, if it's still there? And what can we do to kind of like rehab the deeper muscles a little bit better, so that the deeper muscles actually are the ones that like fill the gap between your two rectus abdominis muscles, which I don't think people know.
Yes, definitely some anatomical things going on that I think people just sort of generalize, and they're like, oh, my abs are separated, I need help. And there's definitely some deeper layers to that.
Literally.
That people are like, yeah, literally. Yeah, I'm curious. I know that you offer some classes on Frank that would definitely work on this deep core work. And I know lots of people are like, this is why ballerinas never struggle after because their cores are so strong. Are there other sort of activities that you would recommend to ensure you're working on that deep core work?
Well, I think we underestimate how much our muscles are working just when we're like standing and moving in our everyday life. So that recommendation of like walking is still really great. Walking with good posture is even better because the better your posture is, the more your core is able to do its job. So that kind of thing is interesting to keep in mind. I think also swimming is really awesome for pregnant people because you feel so much lighter in the water and your core is still doing a lot of work to like move and coordinate your arms and your legs. But I think if someone learns the idea of like core breath, where they're exhaling and gently hugging their belly towards their spine, maybe engaging their pelvic floor a little bit when they're doing something difficult, like standing up can be difficult when you're pregnant, or picking up your groceries, or pushing something through your house. All of that, like that coordination works your core more and is a really great way to just implement it in your everyday activities. So like all activity would be helpful for your core, just using it right.
Yeah, I'm sure there's some pregnant women listening being like, I'm so tired. I'm so sick. It's my first trimester. And I think it can be really hard for people like, you're putting on weight because you're growing a baby and your body is going through so many changes and you're eating so differently, you're sleeping differently. And it can be so hard to commit to just being physical. But it's definitely one of those things that I feel like is the most basic sort of suggestion, but it has such lasting impact on so many different aspects, on sleep, on core work, on your healthier body, on your mood, like all of that. And so, yeah, that's definitely up there on my top recommendations for people.
And I think we can't like underestimate, like Pilates is just like an amazing way for pregnant people to move also.
Mm-hmm. Yes, nice and slow, gentle. I love that. Can you tell us a little bit about prolapse and pelvic floor dysfunction? Are they the same? Are they different?
Okay, so pelvic floor dysfunction is kind of like an umbrella term for any of the issues you can have with your pelvic floor when your pelvic floor is not doing it properly. So incontinence could be a pelvic floor dysfunction, so could painful intercourse. Prolapse specifically is one type of pelvic floor dysfunction where your internal organs, so bladder, uterus, rectum, are sitting lower in the pelvic bowl than they used to, and or they have more mobility than they used to. So your pelvic floor's job is to help support the pelvic organs, either because of like pelvic floor weakness. Sometimes the organs will sit a little bit lower, or as a result of like a really long and hard pushing phase. That excess pressure during birth can create a little bit more laxity in the pelvic floor tissue. I went like into a very deep well when I first started pelvic health because I was like, I feel like everyone has a prolapse. And I wasn't wrong, because the statistic is that like 50% of people will have a prolapse after the age of 50. And so it's another one of these concepts that it's like, oh, so it's actually normal that over time, as our body changes and has less structural support, things sit lower in our body. But again, there's like a spectrum of severity where like a little bit of movement is totally normal. You could have an organ that is going all the way to the opening and you could still be pretty symptom free. What we don't want is for you to feel like you can't do your everyday life activities, or that these organs are like coming out of the vaginal opening or the rectal opening, because that's pretty uncomfortable and also not as common. So just like that tearing, it's like more common to see grade 1s or 2s, but less common to see a grade 3 or grade 4, which would be more of like a surgical thing.
Wow, that is a lot, definitely, especially thinking of that statistic. It's very interesting.
Like it's actually quite normal for this to be happening, but I think it's a really demonized word that it's like unsettling to think that things are coming out or lower.
And is this like when you say it's normal, is it sort of one of those things, sort of like period pain, like just because it's happening doesn't mean it like can't be sort of resolved or made better in some ways?
That's such a nice question and way to frame it. No, when I say normal, it's more to like normalize the stigma around it. I think people are just like so afraid when it does happen, and we should more be talking about like, okay, this is something that can happen with birth, but there's so many things that we can do about it. So, when I see people early postnatal that feel really vulnerable because of that heaviness or that sense of like something not sitting where it should be, there's pelvic floor therapy is like number one gold star for treating prolapse. And you would work anywhere from like training your pelvic floor, rehabbing your core, addressing your posture, considering like how you hold tension in your body can make your prolapse feel worse than it is. And even just like debunking a lot of the myths or the fears in your head can really influence how a prolapse feels in your body. So not normal in the dismissive way of just like deal with it, more normal in the like, there's so much that we can do to work with it. We should just be talking about it more, considering the prevalence of it.
I love that. So just because pelvic pain is normal doesn't mean that it's the standard and that you shouldn't try to help it. So then what would you say to a person who just gave birth and they're like, I feel fine. I don't feel like I need to see a pelvic floor physiotherapist?
I would say good for you, A. And B, you have your whole life to get back to all of the things that you were doing. Maybe just pull the reins a little bit for that first half of the year of getting back postnatal to the things that you enjoy doing physical activity wise, because just because you don't feel something initially doesn't mean that you have the support internally to manage the amounts of pressures that are involved with running or HIIT classes or backpacking around South America with a baby in a backpack. And so it's just like not always as obvious. And sometimes we rush back without having laid down the foundation that's needed to go back to the things that you love to do.
I love that. I think that's especially a good note for the people who probably feel pressure from bounce back culture of like, I need to get back to my pre-baby weight and, live my life how I was exactly before having this kid. And that's just not the case. There's so much more to life and you will never be the same person, and that's okay. And it's okay if you never wear the same pant size either.
Totally. And like, where's this expectation of like 9 months in growing a baby to like 6 weeks out being done growing a baby? Like, it's just, I really try to encourage with my clientele that have maybe goals for 6 months to like a year from now, rather than feeling the pressure of like 2 to 3 months post.
I totally agree. I sort of feel like it took your body 9 months to grow that human. You should give yourself at least 9 months to even start thinking about it. So I think that is a beautiful place to sort of start wrapping up. Please tell us a little bit more about Frank, about you, where we can find you.
Well, you can find me at frankabout.it or frankaboutit.com. And I started Frank really because all my friends are starting to have kids or starting to become pregnant. And I've worked in pelvic health and as a strength trainer for long enough that I feel like I have the brain to help support people through this. And one of the biggest things that I kept hearing in clinic was like, I just wish I had known, or I wish I had started sooner. And knowledge can be so empowering, and knowledge can keep you so much more involved in your pregnancy. And there's so much evidence to show that like strength training or being active while you're pregnant has such benefits on your well-being and your recovery. And also afterwards, everything is so new that if you could have done a little bit more learning before your hands were literally full, it usually helps like calm a lot of this like new sensation that you might be experiencing after, and just put things into like clearer context. So Frank is like a monthly subscription, just like any other virtual online gym or on-demand gym that you have. It's got 2 sections. So if you're prenatal, there's a bunch of like prenatal education videos of anything that is a pelvic floor physio I think is really important for you to understand. And then types of workouts. So there's anything from like sweet mobility workouts to like spicy body weight or banded or weighted workouts that are safe for a pregnant person. And then postnatal, I've created like a little, okay, so you've been cleared to exercise, where should you start? And this is where those people that even if you're symptom free or you have incontinence or prolapse or anything else going on, it's like a really safe place to start exploring movement, strengthening things from the inside out, so that come the end of that 6 weeks, you feel way more able to do everyday movements and things that you would find in classes, and also more aware of like where are your boundaries for yourself in this recovery when you do choose to go back to your yoga class or back to your other class, which by 12 weeks you should be good to go. It's more just like we all recover very differently, and how am I supposed to know if this is too hard or not? So that's why I made Frank, so that you like really get it.
I love it. For the prenatal side of it, how early would you recommend someone sort of start investing in that or looking at doing that before they get pregnant?
I mean, we should all be active. Like, no pressure. I really hate when people like make you feel guilty for not being active enough. But you're probably going to feel like crap for a few months at the beginning of your pregnancy. So sometimes it can be great to start maybe like 6 months before, just to start to develop a bit of that muscle bulk and like confidence with movement, core strength, glute strength, postural strength. But then really there's like, you're never too late. It's never too soon. Just do what you can, especially with like every phase of pregnancy. And I think that's even what we do as people who aren't pregnant. It's like, find things that feel good and try to do them often enough.
Yes, I asked because all of the things that I am the worst at, like posture and core strength, is like everything you need in being pregnant. And so, you know, I feel like I'm a very active person, but I'm like at Barry's doing weights and like running. Get me in a yoga class or a Pilates class, and I'm struggling just because my balance is off. You have to have like so much sort of like inner strength. Like I feel like so strong on the outside of my body, like hit me with some weights. But it's those like slow controlled movements that I'm like, no, this is hard. So I feel like it's just a different kind of fitness, but it's a good recommendation.
I noticed when I was filming the like early postnatal basics program, I was like, oh, I'm so much stronger. Like my deep core was so much stronger. And so I really think that it's for like anyone who has back pain, anyone who's been injured, anyone who's postmenopausal, anyone who just wants to work on their deep core strength. Like we tend to only pay attention to it after we've gone through something major like pregnancy. And yet this could be so preventative for so many other things that, the conversation of pelvic floor is like just new and budding.
I actually feel like those prenatal classes probably would have served me well when I was in a car accident a couple years ago. That's why I was in the hospital. And then after that, I was doing these baby squats in physio. And I was like, it's like I can't even sit down in a chair. My glute is so weak because I had hip surgery. And so even that, I can't imagine having gone to just a regular yoga class, even though that's sort of what I was approved to do early-ish on. So something very gentle would have been nice.
Totally. I completely agree. And there is options. It's just kind of like finding out where the options are.
Well, thank you so much, Rachelle. I appreciate you coming on Bitesized, and I hope all of the listeners go and check you and Frank out.
Thank you. It was so nice to be here. You had such great questions. And if anyone listening has any questions, make sure that you just DM me on my Instagram or TikTok, and I will be happy to answer anything that comes up.
Thank you everyone for tuning in to Bitesize today. I hope you feel that much more empowered to advocate for your health throughout pregnancy, birth, and postpartum. Don't forget to check out Rachelle on Instagram, where she shares a lot of amazing information for you as well. I wanted to remind you about my discount codes. Needed has you covered for prenatals, collagen, omegas, and so much more. You can use my code Bitesized for 20% off your order. If you're still trying to conceive or trying to avoid it, I do recommend checking out OVRY for pregnancy tests, ovulation tests, and male fertility tests. My code is Bitesize10 for 10% off. If you want to know more about OVRY, you should listen to episode 10, which is a full episode on family planning where I share a lot more about them. Don't forget to subscribe, leave a 5-star rating, and a glowing review. See you at dinner club again next week. In case no one has told you today, you look ravishing. Bye! Although I am a certified holistic nutrition consultant, I am not your consultant. The information herein is purely for entertainment and educational purposes only and does not always apply to your specific needs. While I strive to provide you the most up-to-date information about nutrition, this is not a substitute for professional and medical advice, and you should definitely speak to your personal healthcare practitioner for advice tailored to you.